At the beginning of July, a new outbreak of chikungunya fever spread rapidly across Guangdong, China, carried by infected mosquitoes. The disease has now reached many areas, including Beijing, with officials warning that the situation is severe. On July 25th, a town in Guangdong launched a full-scale mosquito extermination effort. Workers went around with extermination machines, and the air was thick with smoke. Online users commented saying, "The mosquitoes aren't here, they're in the sewers," and, "In the end, we might not die from mosquito bites, but from the chemicals used to kill them." Chikungunya fever is really scary. Mosquitoes are being exterminated everywhere. Has your neighborhood started mosquito control measures yet? As of the evening of July 25th, official reports indicated that the number of confirmed cases in Foshan, Guangdong had risen to 4,017. The government has designated 53 hospitals for treatment, and the number of mosquito isolation beds has increased to 7,220. However, given the Chinese government's tendency to underreport outbreaks, the actual number might be much higher. Chikungunya fever, caused by the chikungunya virus, is spread through bites from the Aedes mosquito, and it is an acute infectious disease. It was first identified in Tanzania in 1952. The name chikungunya comes from the Kimakonde language of southern Tanzania, meaning to become contorted, referring to the severe joint pain that often makes patients bend over. Symptoms are similar to those of dengue fever, including fever, joint pain, muscle pain, headache, fatigue, and rash. Most patients recover within 1 or 2 weeks without serious complications. However, newborns, the elderly, and those with chronic illnesses are at a higher risk for severe complications, and in rare cases, even death. Although the death rate is low, the disease can still have long-lasting effects. Some patients report lasting joint pain, with one person mentioning that they are unable to bend one of their legs. I took medicine, the fever went down, but then it came back. I kept having fevers around 38 degrees Celsius, and after the fever, a large rash appeared.
It was so itchy for an hour, and now it still hurts. I don't know if I've caught it, but I'm worried. Mosquitoes are so scary now. Nothing works to stop the itch.
I came to Guangdong, didn't make any money, and got bitten by a mosquito. It's so uncomfortable. Everyone, make sure you protect yourself from mosquitoes. On July 26, a chikungunya fever patient posted a video saying the situation is now worse than it was during last year's outbreak. They have been running a fever for 9 days without improvement and warned people not to take this lightly.
Hello, 大家好。首先跟大家说一下
Hello everyone, I'm not making this video to promote anything or cause harm to society, but to help everyone prevent this. The mosquitoes are not to be taken lightly, and this virus is actually worse than last year's outbreak. The fever is really uncomfortable. A few days ago, when I first had symptoms, my back hurt, my chest felt tight, my abdomen was bloated, and I was completely drained. Don't tell me it's because of weak health. This isn't about that. I work out regularly, and the virus doesn't care about your health. So when you go out, make sure you're well protected from mosquitoes and the virus. I'm still having fevers, at least 2 to 3 times a day, and each fever lasts at least 2 to 3 hours. When I have a fever, my head hurts terribly. It's not like a normal fever where you sleep it off. I've had a fever for 9 days now. I've been hospitalized for 3 days, but there's no real improvement. There's no special medication, no targeted treatment, only immune-boosting injections and fever medicine to relieve the symptoms for a while. But it doesn't help much. After a few hours, the fever returns, and the pain in my head is unbearable. I can hardly handle it. This is not a joke. On July 23rd, Sun Yang, Deputy Director of China's National Center for Disease Control, reported that the chikungunya fever situation in Guangdong province is still very serious. According to official sources, Guangdong has not seen a major chikungunya outbreak in the past decade, meaning most people lack immunity to the virus and are highly susceptible. Official reports and medical experts have noted that there is no vaccine and no specific medicine for chikungunya fever. Painkillers are used to relieve the symptoms. On July 15, the Health Bureau in Shindun District, Foshan City, first reported an imported chikungunya fever case. By July 21st, the confirmed cases had surpassed 2,000. However, a female patient from Foshan revealed on social media that she started showing symptoms on July 6, visited several hospitals, but was misdiagnosed with hives. It wasn't until July 10 that she was correctly diagnosed with chikungunya fever, and the authorities advised her to isolate at home for a week. On July 18th, 5 districts in Foshan issued a notice urging all residents to participate in a mosquito control campaign on July 19th and the 20th. Many locals expressed dissatisfaction and questioned why the authorities didn't implement stricter preventative measures earlier. The chikungunya fever outbreak in Guangdong has spread from the heavily affected Shunde district in Foshan to Guangzhou and even reached areas over 200 kilometers away, such as Yangjiang in the western part of Guangdong. It has also spread outside the province. On July 18th, the Macau Health Bureau reported one imported case from Foshan. The patient, a Macau resident, had visited Shunde district between July 8th and the 17th to visit family. Even Beijing has been affected. On July 22nd, Beijing CDC stated that there have been occasional imported cases, but the authorities have not released data or explained how the virus was transmitted to the city. On July 25th, a Beijing-based influencer posted a video confirming the recent outbreak of chikungunya fever in Beijing.
出大事了，家人们，出大事了！
Something big is happening. Chikungunya fever has arrived, and it's already in Beijing.
完了，兄弟们，疾控肯亚热病毒已经传到北京了。
It's over, guys. The chikungunya virus has reached Beijing. If you have elderly people, children, pregnant women, or moms at home, don't wander around aimlessly. This virus has no special treatment, and if you get infected, the joint pain will make you question your life.
疾控肯亚热现在已经出现在了北京。
Chikungunya fever has now appeared in Beijing. We must take it seriously.
相信北方的小伙伴这两天也已经看到过。
We believe people in the north have also seen news about these dangerous mosquitoes in Guangdong over the past 2 days. Don't take this lightly. Beijing has also had cases of infected mosquitoes, so please be especially careful if you have elderly or children at home.
On July 25th, a Beijing-based influencer mentioned in a video that chikungunya fever has indeed broken out in Beijing recently. The video mentioned that a woman's mother, who works in Haidian District, Beijing, came home one day and mentioned that an infected person had recently been in the store. This individual had been to Xiangshan and had been active in Haidian District. Dr. Sean Lin, a US-based virus expert, stated that these mosquitoes are mainly found in Southeast Asia, Guangdong, Guangxi, and China. He noted that in recent years, these mosquitoes have been moving north, so northern provinces need to be cautious as well. Experts also said that although chikungunya does not spread directly from person to person, humans are still a source of transmission. When a person gets infected, they often experience viremia, which means mosquitoes that bite them can spread the virus to others, creating community transmission. One blogger warned that the virus could spread more easily during the peak tourism season. During the summer, when tourism is at its peak, there's more movement of people, vehicles, goods, and logistics. Mosquitoes can travel with shipments or even on luggage, spreading the virus far and wide.
比如说蚊子给广东下个卵。
If mosquitoes lay their eggs in Guangdong, they could travel with express deliveries, logistics, people, and luggage, reaching Beijing, the northeast, and other parts of the country. In each place, they hatch new mosquitoes that can bite people. The key is that chikungunya fever has an incubation period. If a mosquito bites an infected person in Guangdong, then travels north and bites a healthy person, that mosquito could carry chikungunya fever as well. It's not just mosquitoes, humans can carry it too. You can't control that. Also, mosquitoes can bite humans, and humans are mammals, just like cats, dogs, cows, and sheep. What will you do? The critical point now is that it's the rainy season. It's raining in July and August, and with the high temperatures, mosquitoes are everywhere. What can you do? The key issue with chikungunya fever is that there's no special treatment. Apart from high fever and rashes, it causes severe joint pain that can lead to joint damage and, if not treated, paralysis. If you're older, that's one thing. But what about a 10-year-old, a 20-year-old, or a 30-year-old? What will happen to a 7 or 8-year-old child? If you have a low immune system, or if you're elderly with underlying conditions like diabetes or heart disease, it could trigger complications. People like that must take extra precautions when going out. We need to boost immunity. We need to isolate groups of people who are infected. Diagnosis still requires a nucleic acid test. It could take 3 to 5 hours to confirm the results. For chikungunya fever, one of the first symptoms might be shoulder pain, followed by a fever. According to local hospitals in Guangdong, chikungunya fever is mainly transmitted by mosquitoes, so strict mosquito control and isolation measures are necessary. Since there are no self-testing methods available at the moment, everyone must go to the hospital for a nucleic acid test. Currently, home isolation is not allowed. The discharge condition depends on the nucleic acid test result, and patients can only be discharged if their test result is negative. Doctors emphasize that anyone experiencing joint pain, fever, or any symptoms mentioned in emergency care should seek medical attention immediately.
现在我们是来到了顺德区北教医院。
Now we are at Beiluan Hospital in Shunde District to see the conditions at this designated treatment hospital and to check out the patients and the wards. First, we can see that unlike regular wards, each room has been fitted with screens to prevent mosquitoes. Now, let's take a look at the conditions inside the ward.
我老是说我是痛风，不是。
At first, my family thought I had gout because the mosquito bites were so severe it started swelling and I felt a bit uncomfortable. I couldn't move my joints, my legs hurt a little, and I could only walk with support.
I recommend not coming to Shunde recently. The chikungunya fever situation here is really serious. I live in a village and I've never seen the village committee come to do mosquito control. We've almost stayed home for a week now. I don't dare to go out because there have been several cases of dengue fever nearby. We don't know if there's chikungunya fever as well. The risk is really high. Even after the fever subsides, the pain continues, affecting skin, muscles, and joints. Many housewives are trying to find ways to eliminate or repel mosquitoes, typically by burning mosquito coils. One influencer posted a video showing a room full of mosquito coils and said,
为了我们佛山那个臭蚊子啊，我也是拼了。
I'm really doing everything I can to fight these terrible mosquitoes in Foshan. Can you tell me if this method works? Or is there a better way? Right now, I have mosquito coils all over my house. I'm really afraid of these mosquitoes.
However, some online users said, have you noticed that the mosquitoes this year are especially strong? Even mosquito coils don't work. Others commented, the mosquito's resistance is far beyond the national standards for mosquito coils. Another user speculated, could it be that the manufacturers are cutting corners because the profit for mosquito repellent products is too low? There's been public dissatisfaction with the government's mosquito control efforts due to inadequate action. On July 20th, a resident of Shunde Foshan shared a video revealing the government's lack of action. The resident from Shilong village said that while the village organized mosquito control and checked for stagnant water, there was significant dishonesty. A drainage ditch in the village had accumulated black, foul-smelling water, breeding mosquitoes, but despite reporting the issue for days, the village committee had yet to take any action. There has been no official response to the complaint so far. An influencer captured footage of a smelly drain and suggested that this kind of foul-smelling water channel could be the source of the sudden chikungunya fever outbreak in Guangdong, urging that it must be cleaned.
嗱，領導，啱先我睇嘅情況咧就喺對面安康對面嚇。
Leader, I observed the situation across from the bank. A tenant told me about the unbearable smell from the sewage drain. On July 24th, in Foshan, a local resident angrily questioned health officials. His tenant had complained about the unbearable smell from the drainage, but the local government's response was simply, we don't deal with this matter. When the resident tried to take the official to the site, they replied, we are here to deal with dengue fever. The resident became more frustrated and said, the sewage from the drain smells terrible. In response, an official remarked, sewage from the drain doesn't breed mosquitoes that spread dengue fever. A nearby citizen couldn't help but laugh and sarcastically commented, even my houseplant can house mosquitoes. Do you really think the drain won't? Regarding the hospital's requirement that patients must test negative before being discharged and that home isolation is not allowed, people are particularly concerned about whether they will have to pay out of pocket for isolation at the hospital. Some patients, unable to afford the self-paid isolation, chose to leave the hospital prematurely. The Chinese government has once again implemented measures to isolate patients, a move that reminds many of the strict zero-COVID policies from the past 3 years. Netizens are complaining, feeling as though they are going through the same process again, just with a different disease. Some question the use of tests, stating, what's the point of doing another test? They're just starting the same disruptions again. The World Health Organization issued an urgent warning on July 23rd, cautioning that the mosquito-borne epidemic that spread globally 20 years ago could return. Chikungunya fever had a major outbreak 20 years ago on the Indian Ocean island, Reunion, and over 100 countries reported the disease. Now, 20 years later, it has resurfaced in China. From various sources, it seems that the Foshan CDC is not only blaming overseas imports, but also hiding the fact that the Chikungunya virus had already broken out locally. The Chinese government's habit of falsifying data, whether related to the pandemic, economic statistics, or population figures, is well known to the international community. This was especially evident in the initial stages of the COVID-19 outbreak in Wuhan, where the government was accused of covering up the epidemic, contributing to the global pandemic. David Xu, former director of the acupuncture department at a Chinese traditional medicine hospital, stated, "This is the Communist Party's usual practice. They cover everything up first, observe, and when they can't control it anymore, they inform the public. They never consider issues from the people's perspective."